Yeah.
So norma verticalis. See, this is the like view of the skull bone, which helps us to study about norma verticalis. So this is the anterior end and this is the posterior end. And towards the anterior end, we have frontal bone, and on either side we have two parietal bones. Behind we have occipital bone. So between frontal and two parietal bones, we have fibrous joints in the form of suture, which is called coronal suture. Between the two parietal bones, we have a suture which is called as sagittal suture. Then between two parietal bones and occipital bone, we have one more suture which is called as lambdoid suture. Okay. Now,
Okay.
so this area of this skull bone, what you have just seen, this is actually called as vertex, also called as cranial vault. Okay, so it has maximum breadth. The brain, like bones which are forming, are like we have through three sutures which I have shown you. Sometimes between the two frontal bones also you may have a suture in this direction like this. Basically, two frontal bones during fetal life are two separate bones. They get fused in such a way like we usually do not find suture, but sometimes the suture may be visible, and that suture is called as metopic suture. Okay, so now meeting point of this coronal suture and sagittal suture is called bregma. Meeting point of this sagittal suture and lambdoid suture is called lambda.
Lambda.
Yeah. And in case of fetal skull, instead of bone here, you will see there will be a membrane because skull
Holes. Front, right?
is ossified, and you call that area as anterior frontanelli. Behind you call it as posterior frontanelli. Okay. So
Mm-hmm.
like vertex is this particular view what you are finding. So we have two parietal eminences. The maximum elevation of the parietal bone is actually called as parietal eminence. The maximum elevation of frontal bone is called as frontal eminence, like that. Okay, so we also have see on either side of sagittal suture, two holes are seen, which is called as parietal foramen. When I have discussed scalp, I told you it gives passage to emissory veins, which connects the veins of the scalp to the veins of the brain. Okay, then we can actually measure cephalic index, which is nothing but maximum breadth of the skull bone. Like this is the maximum breadth if you measure. Okay, where we have the widest part of the parietal eminences divided by maximum length. So this would be the maximum length multiplied with 100. It gives cephalic index. So we have different types, and the shapes of skull bones are different and differs from person to person. So we have like dolichocephalic, where the head of the person will be long. So maximum width is actually less than 75% of maximum length. Okay, so such long-headed skulls are actually called as dolichocephalic. Okay, then suppose if it is greater than 80%, you call it as brachycephalic, like broad-headed, and it looks like a short head. If it is between
Okay.
75 to 80, we call it as mesenterocephalic. I'll try. I think I have kept the pictures. We will see. Okay. Now, see, this is fetal skull. In the fetal skull, you are finding membrane is still intact, where you call it as anterior frontanelli and posterior frontanelli. Okay, I said like in case of fetal skull, there is a suture between two frontal bones, and if it is also seen in case of adults, we call it as metopic suture. In fetal skull, it is called as sinciput. Sinciput. Okay, and the
Okay.
outside brain, like membrane, what we have at the area of bregma is anterior frontanelli, and behind we have
Ma'am,
this.
1 second. I just need 1 second.
Huh, okay. Actually, that diameter I said we take it from like parietal eminence. So this is biparietal diameter measuring around 9.5 centimeters. and this is like by temporal diameter, which is measuring around 8 centimeters. So
Okay.
this area is anterior fontanelle. This is posterior fontanelle. Apart from
Mm-hmm.
that, if you just see the lateral view, see here there is a meeting point of certain bones like frontal bone, parietal bone, sphenoid bone, and temporal bone. That particular area is called pterion. Okay. Similarly, behind also this point will be actually called as asterion, where you will see the meeting point of parietal, temporal, and occipital bone. That is asterion. And the maximum pointing area behind is called as enion, like where we have external occipital protuberance. And in front, we call it as glabella. Glabella. Okay, where we
Yeah.
usually keep that belly, that is glabella area. Okay. Below that,
Mm-hmm.
mesion. So this is the true skull bone where you can see frontal bone, two parietal bones. These are parietal eminences. These are parietal foraminae. And this is occipital bone, coronal suture, sagittal suture, lambdoid suture. Okay. Now, if you just see like the brain, so there will be a sulcus associated to this temporal bone in the lateral aspect. You call it as lateral sulcus. Okay. So norma occipitalis, I told you the previous day. I hope you remember.
Yeah.
So sagittal sulcus, like sagittal suture, lambdoid suture. This area is like what do we call it as lambda. Sometimes we may have sutural bones, extra number of bones we may have, like as you are finding here, one extra bone, supernumerary bone it is called as. Okay.
Okay.
Mm. So I said this is asterion, right?
Mm-hmm.
Mm. I'm just checking if so the lines are like this is lambda. Sometimes we may have sutural bones, external occipital protuberance, highest nuchal line, superior nuchal line, inferior nuchal line. Okay, different colors have been used. So now you want me to tell norma lateralis. So are you able to see norma lateralis on the screen?
Yeah.
Oh. So norma lateralis, various bones are taking part. That's the reason I have used different colors. Like for frontal bone, you can see golden color is used. Parietal bone, pink or little violet. This is temporal bone. In pink color, we have sphenoid bone. Okay, and this is occipital bone. So now, the lateral view, whatever bones are seen, are not only that, you are finding zygomatic bone, lateral view of orbit, ramus of the mandible. Now, if you just observe the labelings, so you will see again between the frontal and parietal, we have coronal suture. We know this is the parietal bone, temporal bone, and we know this is lambdoid suture. Okay, and this suture is quite smooth, hence we call it as squamous suture, which is between the parietal and the temporal. We call it as squamous suture. We know this is zygomatic bone. Okay, and this is actually the zygomatic process which is starting from temporal bone. And this is zygomatic bone. And from the zygomatic bone, actually we call it as temporal process of zygomatic. The orange one is zygomatic process of temporal bone. Blue one is temporal process of zygomatic. The words are quite opposite and you are finding a suture between the two processes and the suture is zygomatico-temporal suture. Zygomatico-temporal. Okay.
Okay. Yeah.
Yeah. Now you are finding, now this is occipital bone, like there is nipple-like projection coming from the temporal bone. You call it as mastoid process. Okay. So within the
Okay.
temporal bone, there is opening, external ear gets decayed, no? So the bony component of external ear is external acoustic meatus, medial to which you are finding there is a needle-like projection downwards, which is styloid process. So this is ramus of
Right.
the mandible. Okay, so it has one projection which is called a condylar process. This is coronoid process. Condylar, condylar process and coronoid. And in between them you have a notch. You call this as mandibular notch. Condyloid process can be also called as mandibular condyle. This is coronoid process. This is mandibular notch. This is ramus of the mandible. This whole thing is body of the mandible, and the junction of ramus and body, it is called as angle of the mandible. Angle of the mandible. Then now see here, this is orbit, right? So in the orbit, if you see, roof is formed by which bone? You can see here, roof is formed by frontal bone, floor is formed by zygomatic bone, isn't it? Not only zygomatic, you are also seeing a part of violet bone, that is maxilla. Lateral wall is formed by frontal bone,
Zygom,
and
frontal bone and zygomatic.
very good. Medial wall is formed
Frontal, medial is by frontal and the maxilla,
exactly.
and the lacrimal.
Yeah, very good. There is a part of some other bone also.
Maxilla, right? Ethmoid?
Ethmoid in red color.
Yeah.
Okay. So, right sharpness of nose is contributed by this nasal bone. So, I now see in the maxilla, this particular area is called as alveolar margins, where we have the sockets for the tooth. This is mandible. Here also we have alveolar processes. Okay. And mandible bone has a foramen which is called as mental foramen. Okay. Mental foramen. So now coming to the lateral view of the skull, which is called as norma lateralis, when you view the skull from the lateral aspect. So now if you just observe, there are two lines also which are called as superior temporal line and inferior temporal line. You remember when we were doing attachments of scalp, I said the scalp is attached to the superior temporal line. Okay. So norma lateralis is exposing to our side to two foci also. Like if you just break this zygomatic arch and also the ramus of the mandible, you will be able to see the deeper components of the skull bone, which is called as infratemporal fossa below zygomatic arch and temporal fossa above the zygomatic arch. So we will have temporal fossa, infratemporal fossa, more deeper inside we have pterygopalatine fossa. Okay, so this is
Okay.
like median sagittal section of the skull bone, where you are finding the interior view of these skull bones, like interior internal aspect of frontal bone, parietal bone, occipital bone. We are also finding the like this is temporal bone only, the one which is shown in orange. The one which is shown in pink is sphenoid bone. Okay, and these are the sphenoidal air sinuses. Okay,
Yeah.
you have this is actually cribriform plate of ethmoid we get. These are superior and middle nasal concave, which are part of ethmoid bone. Inferior nasal concave would be separate bone. Okay, then this is in blue color we have vomer. Okay, so sphenoid bone has two projections like median and lateral pterygoid processes. This is hard palate where we have upper jaw contributed by maxilla bone. This is lower jaw which is contributed by mandible bone. Okay,
Yeah.
so maximum possible views I am showing you. Sphenoid
All right.
bone has an empty space, right? This is the sphenoid bone. So, and this is sphenoidal air sinus. Okay, this one. Frontal bone also, if you break and see, there will be a air-filled space which is called as frontal air sinus. So we have air sinuses around nose which are called as paranasal air sinuses. So frontal is one, sphenoid is one more. Okay, we also have ethmoid and maxillary sinuses. Okay, now
Yeah.
bones,
Okay.
norma lateralis, let us review. So this is temporal bone, parietal bone, occipital bone, frontal bone, Blue one is zygomatic, violet is maxilla, orange is mandible, blue is nasal bone. Okay, it is only for our convenience different colors have been used. And this is sphenoid bone in pink, lacrimal bone in green. Okay.
Right, okay.
So like lateral view of the skull bone in fetal skull, just now I told you we have like anterior and posterior frontanelli we see in norma verticalis. Similarly, we have membranous gaps on the lateral side. Those are also like just now I told you we have pterion and asterion. So at that point we have like different frontanelli, like we have sphenoidal frontanelli anteriorly, anterolaterally in the sense. Behind near the mastoid process, you call it as mastoid frontanelli. Okay, that means still the gaps are there, membrane has not yet ossified. That's the reason you are finding these gaps. Okay, till the skull bone is completely growing. So different
Okay,
forms of the skull you are finding frontal, parietal, occipital, temporal, sphenoid, mandible, maxilla, zygomatic, nasal. Okay. So sutures, everything I have already shown you, better nothing. You can just, this is a new word, like at the opening of the nostril area, you will find there is one projected pointed area, you call it as anterior nasal spine. So above the
okay.
nose, the area is called as superciliary arch. At this chin,
Mm-hmm.
call it as mental eminence. This is the mandibular notch, mandibular condyle, coronoid fossa process. Angle is can be also called as gonial angle. Okay.
Okay,
Hmm. So I said like we have three fossae. So norma lateralis, if you just break certain parts of the bones, we will be able to move deeper and deeper. So we have temporal fossa, infratemporal fossa, and pterygopalatine fossa. Now see, this is zygomatic arch. So above zygomatic arch, whatever fossa you are finding, that is nothing but temporal fossa. So we will see its boundaries, we will see its floor. See, these are the temporal lines, superior and inferior temporal lines. And this is mastoid process, above which you will see a crest, which is called as supramastoid crest. Everything we will take in detail. So again, you can see pterion, okay, sphenoidal frontanelli. Then mastoidal frontanelli is asterion. So this is all temporal fossa, above zygomatic arch. This round circle you have to understand. Okay. So above and
okay,
behind, just 1 minute. I wanted to ask. So the temporal fossa is whatever you are finding round completely. So
okay,
above and behind, you have these temporal lines, right? So this is above and this is behind. So above and behind, it is bounded by temporal lines. In front, we have temporal surface of zygomatic, this one better, this all orange area. Temporal surface of zygomatic, this one, greater wing of sphenoid bone. In front, we have these two bones. Okay, below is this, right? So below and behind, what are the bones we have? See, superior mastoid crest. So superior mastoid crest would be this, the one which is in green color, superior mastoid crest of temporal bone. Okay, this is below and behind. Then below and in front, see, this is below. If bone is there in your hand, you can just pass your hand inside the zygomatic arch. You will see it is passing from temporal fossa to infratemporal fossa, Bhavya. దీని
okay.
లోపల ఒక హోల్ ఉంటుంది, లైక్ బిగ్ ఓపెనింగ్ త్రూ విచ్ యూ కెన్ పాస్ యువర్ హ్యాండ్స్ from temporal fossa into infratemporal fossa. So below and in
Mm-hmm.
front, it is actually communicating with infratemporal fossa. Okay. Now this area is complete blue, your green, yellow, pink bones are nothing but forming the floor. So what bones we have? We have frontal, we have parietal, we have greater wing of sphenoid bone, we have squamous part of frontal, and this area, temporal bone. Okay, all this is actually forming the floor where you can just scroll your hand and feel it, feel the smoothness of this particular area. This is actually the floor of temporal fossa. Okay, so this
Okay,
is completely the temporal fossa. What is this dotted area called as? Four bones meeting point? T
Um,
Terion. This is asterion. Okay. And in
okay,
the temporal fossa, you have a muscle called as temporalis. So temporal
okay,
muscle, it is the zygomatic arch. It is actually passing deep to the zygomatic arch and getting inserted into coronoid process of mandible bone. Okay. Now, if you just observe this parietal bone, it has four angles. One angle is this point, second angle is this point, third is this one, and fourth is this one. Okay, so this four angles generally, suppose if we have roughening in the sense we can just drill a hole to check the bleeding or to do any surgical procedures. So we know this is bregma, we know this is lambda, we know this area where we have five bones meeting point, that is the bregma, I'm sorry, asterion, where we have underlying sigmoid sinus, sorry, terion, this one is terion, behind we have asterion. Okay, asterion area,
okay,
see inside the skull bone, it will be correspondingly lodging sigmoid sinus. Bregma lambda are actually lodging superior sagittal sinus. Okay, then pterion will be actually lodging the anterior divisions of middle meningeal vessels. So this picture I have already shown you. And then I said this is the zygomatic arch. So articulation, I said we have temporal process of zygomatic in blue color, zygomatic process of temporal in orange color coming from temporal bone. This is the suture.
okay,
Yeah. You just talk about zygomatic arch. It has upper margin which is sharp, it is the outside inwards. Now, Galia aponeurotica, which is the third layer of the scalp, it is getting attached over here. Not only that, temporalis muscle will be covered by temporal fascia. It also gets attached over here. Okay. So this zygomatic arch in front, it is continuous. Now you can see it is in continuation with this superior temporal line. Behind, if you just continue this, this becomes the supramastoid crest area. Zygomatic like arch behind it is in continuation with the supramastoid crest. Okay. Now here two bones
okay,
are shown exclusively. One is temporal bone. Okay, and this is the like part of temporal bone only. So you are finding the lower margin. Of course, here you will see the attachment of masseter. All these things now you don't require. You will get confused. Now this is the basal view of the skull bone. In the basal view, you will see there will be mandibular fossa. Obviously, mandibular fossa will be here. That means it is
okay,
giving placement, like this is the place where head of the mandible comes and articulates in the mandibular fossa of temporal bone. Mandibular fossa of temporal bone, head of the mandible, or the condyloid process of the mandible to form temporomandibular joint. Temporomandibular.
okay,
This is the only mobile joint which we have in the face. Okay, so this is about mandibular fossa. So it has articular part, it has non-articular part also. So articular part will be placed anteriorly, which is formed by this bone. We know already this is the squamous part of temporal bone. Non-articular
mm-hmm,
part is posterior, which is formed by tympanic plate of the temporal bone. So between these two articular and non-articular part, there will be a fissure. You just observe in the skull bone, you may be able to find anyhow. These
okay,
few details nobody will ask you, but still I'm telling you, like we have squamotympanic fissure. Okay, squamotympanic fissure. If you go more deeper inside, we have petrotympanic fissure. Okay, petrosquamous fissure also. So all these gaps, no, they will be transmitting certain structures like cauda tympani nerve, okay,
yeah,
maxillary artery, anterior ligament of malleus. So this is all about temporal fossa, articular part, non-articular part.
yeah,
This is completely our fossa beta, the mandible, also called as glenoid.
right, okay,
This is the fissure between the articular and non-articular part. It's completely temporal bone. This is zygomatic arch. This is smooth. Smooth part is always called as squamous part. This is external acoustic meatus, styloid,
Yeah.
mastoid process, suprameatal triangle. I said right. This is like a triangle. Okay.
Okay.
Hmm. So it is seen at the root of the zygomatic process. This is all zygomatic process. Squamous part of the temporal bone, which is smooth, external acoustic meatus, styloid process, petromastoid
Mm-hmm.
bone. This is mastoid process. You remember, because
Yeah,
wherever
okay.
it is rough, we use the word petrous. Wherever it is smooth, we call it as squamous. So these are different parts of
Yeah.
temporal bone only. This is completely temporal. Squamous part, petrous part, pointed thing is styloid, okay, projected thing is zygomatic, and the opening of
Okay.
this is external acoustic meatus. Okay, so this is external acoustic meatus. So we have tympanic plate. Okay, then it has, see, if you just see it in front towards the zygomatic process, it has anterior wall. Behind towards the mastoid is posterior wall. Earbuds we use to clean the earwax, and you will be just pulling it downwards and outwards. No, that area will be the floor. So it has anterior wall, posterior wall, floor. Okay, and this is of course squamous part of the temporal bone, which is forming the roof and posterior wall of external acoustic meatus. Okay, medial end. That means if you just keep the earbud and go more medially, you will see there will be a eardrum called tympanic membrane. Tympanic membrane. This you will understand more when we do ear, middle ear boundaries. You will come to know lateral boundaries formed by this tympanic membrane. Okay, so this is one more picture where you have different, like so many details are not required. Squamous part, you know, zygomatic process, styloid process, mandibular fossa, mastoid process. Suprameatal triangle, I said, right? Immediately above
Yeah.
the external acoustic meatus. Root of the zygoma is meeting that point only, suprameatal spine. Okay, so it has the link may go in less than 1 minute. I will resend. So this is the posterior
Okay.
margin of external acoustic meatus. This vertical tangent. You need not remember so many names, but just try to remember. We have suprameatal triangle above external acoustic meatus. Okay. So this
Okay.
projection, nipple-like projection, is the mastoid part. So this mastoid part is actually giving, when you do triangles of neck, you will come across posterior and anterior triangles, so which are separated by the sternocleidomastoid muscle. So here you will see the attachment of sternocleidomastoid, splenius capitis, longissimus capitis. Okay, if you see inside this one, here you will find
Okay.
posterior belly of digastric, and there is a groove for occipital artery inside view, inner surface of mastoid part.